My name is Patricia Harman. I came to UK from Kenya. I didn't go into the nursing myself. There's a time I was thinking so much about doing the nursing. So I was promoted as a senior healthcare assistant for all the courses that I've done. So the other staff who come when they are new, healthcare assistants, I try to coach them. I show them how to do the observations, how to talk to the patients, how to smile to the patients, be kind, be good to them. And some of them have even gone beyond me. They have become nurses. So I'm happy and I'm grateful for that. I enjoy myself taking care of the patients, and some of them, they call me a blessing. I've received letters, I've received small gifts from them, and I'm so proud. I love this hospital because it's my first place. They are the ones who introduced me to NHS. They are the ones who gave me the job, and I'm enjoying being here.
Hi, my name is Bernice Bore, originally from Kenya. I came across to study and started my nursing career in the NHS in 2004. I have worked in various capacities, very acute jobs where every second of the patient's life in my hands counts. So I spent a lot of time in the renal department. In 2016, I started the medical day unit called Battle Day Unit as the first sister. So my passion for starting the day unit was so that I stop unnecessary sleepovers if a patient doesn't need to stay in the hospital bed overnight. That time, being a part of the renal family, I have achieved one of the best awards in my career, and it says is the winner of RCN Southeast Making a Difference Award 2020 in celebrating Black History Month. Can't say how happy I am working for the NHS and working for our Berkshire Hospital, which is a hospital that I feel we are listened to.
My name is Calvin. I'm originally from the beautiful island of Barbados. And I came over to this country in September 2000 to join the Royal Berkshire Hospital in the ICU. And I spent a year there. Now I'm currently working in the recovery. I had an associate degree from back home, but I was able to go on the degree pathway and convert it into a full degree. So that was a nice learning opportunity. We have quite a bit of Bajan community in Reading, because apart from Barbados, the other high proportion of Barbadians are actually in Reading. So it's like a second home. So one of the things I try to work is to do credit to my nation wherever I go. That's part of our motto in Barbados, where you say, I pledge allegiance to my country, Barbados, and to my flag, to uphold and defend their honor, and to do credit to my nation wherever I go. So that's how I work, and basically that's what comes through everybody. Where are you from? Barbados. Oh, so I big up Barbados. That's me.
My name's Yvonne Clanger, and I'm Head of Mental Health Commissioning for Berkshire CCG. I'm a mental health nurse by profession and background, and I've enjoyed working across Berkshire West, so in Wokingham, Reading and West Berkshire over the last 13 years. I started working in the NHS in Oxford and then moved over to BHFT, where I worked for a few years in frontline services as a mental health practitioner. I also got the opportunity to work within the RBH as a mental health nurse in the A&E department, and currently I'm actually working for Berkshire CCG, where I focus my work on mental health commissioning, just making sure that we provide the best service to our communities who are experiencing mental health challenges, and making sure that as a citizen and resident, I also get a good service. A high for me was starting to engage and interact with people in senior positions who then start to ask questions about what my passions are and how I could actually bring those into work. And that bit of recognition is very important, particularly from a BME background.
My name is Kudain Cardino, and I'm a senior specialist nurse in respiratory department. I started my career in 2001. I came from the Royal Brompton in London, and I moved here to Reading in 2005, and I started in the chest clinic. I then moved over to occupational health, and I came back to respiratory medicine again in 2018. I am involved with a BAME network. This is a forum where Black, Asian, minority, ethnic members of staff meet regularly. It's a great network to be involved with, where issues are raised and discussed and a way forward is mapped. So it really leaves you feeling included, valued and respected as an ethnic minority employee. Also, I just want to appreciate the support that I feel we've had during the COVID period. Black, Asian, minority ethnic group, we were disproportionate, but I think we've had so much support. I enjoy my time at Royal Berkshire Hospital. I think at this hospital there's a great sense of community, and alone that really makes me want to stay here.
My name is Evans Dubiwa. I am a registered mental health nurse. I came into the UK is almost 20 years ago. I had an opportunity to join the NHS in 2009 as a trainee psychological well-being practitioner. I've been with the service here for just gone 2 years, being involved in various projects and roles, engaging BAME communities in making sure that they have access to psychological therapies. I am recently undergoing a master's in business administration with a sort of a health care perspective. So I've had the opportunity to be supported and sponsored to undergo this MBA program. UK has made me what I am, but I will never forget, where, I grew up and where I was born, which is back in Zimbabwe. People say there's no place like home. UK has become a home away from home.
My name is Ade Okoha, and my role is Associate Chief Pharmacist for Clinical Services. Well, I moved to the UK in 2001, and shortly after was able to do the conversion courses to enable me work here as a pharmacist. It's a lovely trust. It's full of friendly people. I think there's good leadership in the trust. It's a place that fosters and encourages innovation, and that's what I like best about working here. I've found the NHS a very supportive environment. I've met with people who have been willing to help me on my way and identify opportunities for which I've taken, and I've been able to, take steps of progress. There have been lows. There have been times when I've felt alone, or I felt the expectation people have of me. You kind of feel prejudged, as though not much is expected of you and you have to prove yourself. And for that reason, I felt the need to work a lot harder. And in a way, this has been an advantage. I, really take pride in doing things well, because in a way I feel I'm not just representing myself, I'm representing my ethnic minority.
When I started working the NHS quite a few years ago, there wasn't a lot of inclusiveness and diversity, which I'm a big champion for. There was lots of challenges around promotions and being accepted into roles. You would physically get abuse from patients and verbal and things like those, but things have evolved.
I think that the trust is being proactive in its approach. If I compare this trust to where I worked before, you see a lot more Black people in the various areas of, progression and in places of power, so to speak.
The Black History Month is really about reflecting on the achievements that have been made by people from Afro-American backgrounds. Not only recognize, I think it's also important for us to be able to showcase them.
Originally, it was about the Windrush, basically celebrating and finding our feet, we people from the Black and ethnic minority.
And to also reflect on the journey that has brought us to where we are. Some of us, our journey might be quite different from others, and in some cases the journey is the same, but the experience of the journey is different, and that experience many times can be linked to the differences in our skin color. You might be in the same place, for instance, but then one might find that you're the only black person in the room. What you get out of the environment maybe, or from the experience, might be different from what somebody else feels in that area.
Being included in all the decisions, the discussions around the workplace. And I think as BME, we do contribute a lot to the NHS. And yeah, so it feels great that somebody has taken time to recognize that.
People can get an opportunity to check their history and learn a bit more about Black history.
Some of the things that we may not talk about quite a lot is some of the people in our nursing department. So Mary Seacole, she paved the way for someone like me to be doing what I'm doing today.
Like I admired a lady, Elizabeth. Around this time we are thinking and we are trying to promote those who will come behind her or follow her footsteps.
Learning about other people's cultures, from the Caribbean to Africa, occasions where we bring food into the offices. This was pre-COVID, so I was born in Zimbabwe, but I'd like to talk about some of those events with my colleagues in the office. I do hope that one day we won't call it Black History Month, it'll just be History of the UK.
Change is here and change is coming, and for one to be able to influence that change, you have to be part of the process. So I think we need to embrace what's going on, we need to embrace events like this, and we need to sit at the table so that we can also shape the change.